Great. So, who are susceptible to, anemia basically?
Okay, the susceptible group is, of course, the females, okay, the women, especially the women who are menstruating because, there is blood loss every month and they have to cope up with it kind of iron. So, yes, they do require a good amount of iron. Any growing girl, okay, a pregnant woman, okay, and even women who is lactating, they all require iron. Because pregnancy में सबसे ज़्यादा iron चाहिए, because it's not only for the mother, it's for the child as well. So they are the most vulnerable group or most susceptible to be deficient in iron. All right. Another group is your kids. Okay. So kids basically have this condition called as pica. Okay. You have seen kids, in fact, my kid did that. All right. And so I understood. आपने देखा है बचपन में, these kids, they just peel off the wall paints and they want to eat चूना खाते हैं, right? This is not calcium deficiency. It's an iron deficiency. People mistaken it for calcium and
Yes.
calcium भर भर के. Okay, but it's actually an iron deficiency. So kids are prone to it because they are growing. Okay, someone who has some metabolic disorder, yeah, some disease which hampers the absorption of iron, okay, is susceptible to iron deficiency anemia. Okay, so these are one very, susceptible groups. Okay, and the last category is the geriatric, that is the older population, the aged population, because of the amount of food that they do not eat well, okay, or maybe healthy, or the choices, and because they're so rigid in choosing their food, they're more susceptible in that term.
Okay. And so we are saying that males are not at that high risk?
Generally not. Okay, because the loss of blood is, or the requirement is not that higher. Generally, I have hardly seen any male to be an iron deficient. Okay, they can be folic acid deficient or maybe B12 deficient, but iron deficiency anemia बहुत कम देखा है.